Hi all of you might have known about the recent changes in OSCE adult examination. That is very simple. Instead of your subcutaneous injection using your insulin needle or insulin syringe, you can expect injection using insulin pen. Okay, so that is the recent change that has been amended in the OSCE adult station. So we are going to learn how to use or how to give an insulin injection using insulin pen. All of you are aware about how to use or how to give an injection using subcutaneous injection, which is there already in my channel. So now we are going to learn about how can you give an injection using an insulin pen. Actually, this is very simple. You don't need to get worried about it. The reason is it is much easier for you to give an injection using an insulin pen when it compares with insulin needle. Okay, so we are going to start. All the rest of the procedure are very similar. That if you get a question paper, you will be starting with the pre-checks. You will be checking for the safety. You will be checking for the privacy, doing the hand hygiene as per WHO protocol. You are going to verbalize all the 7 steps of hand hygiene. You're going to demonstrate it, and if you're comfortable, then again you're going back to the patient or you're going towards a patient. You're going to introduce yourself. You're going to check the ID. You are going to ask, are they comfortable, allergy, pain, and explain the procedure, gain consent. If you are happy, then you're going to collect the articles. Usually when you're collecting the articles, if you're giving an injection using an insulin needle, what all articles are you going to collect? Obviously, you are going to take the syringe, checking the date, whether it is in date or intact. Same as like the rest of the station, you will be collecting all the required articles and collecting it into the tray. What happens with your insulin, insulin injection using insulin pen? This is the pen, that how it looks like. There will be a cap, there will be an insulin pen, and here the medication is over here, or the pen contains the medication. Okay, so that will be kept over there. So when you're collecting the article, get the tray, ask the assessor, can you confirm whether this tray has been cleaned in last 24 hours? Assessor will tell yes. You're going to collect all the articles that includes your medication. When you are taking the medication, obviously for insulin syringe, the medication is separate, which will be kept in a vial, isn't it? But in insulin pen, the medication itself is here in the pen. So you are going to take your prescription, you're going to take the medication, and when you take the medication, you can check the expiry, and here I have an expiry of 4/26. Okay, so this will be expired in 2026. You will be checking the expiry, verbalize that this medication is okay. This is Lantus, and the dose is this is 100 units per ml, so it's been clearly mentioned. You're going to read it out, take the medication prescription, read it out, compare it, and make sure that you are taking the right medication. For example, if you are getting Lantus of 60 units, then you will be reading, okay, this is Lantus, the prescribed dose is 60 units, and you will be checking whether it is the Lantus, the prescribed unit is 60, and you know that this is 100 units per ml. So you are just checking the dose, frequency, checking the prescription time. All the right prescription has to be checked over there. So all the checks we have already explained in many videos. I'm not going to explain all those things. Basically, I'm going to tell how to use it, those who don't know how to use an insulin pen. There is no criteria, or there is no change in the criteria yet. So I'm just going to teach you basically how you are going to administer an injection using insulin pen. And if there is any change in the criteria, or if there is any change, then obviously I'll be redoing the video. But this is usually how we do the procedure when we are giving an injection using an insulin pen. Okay, so when you're collecting the article, obviously you need a pen, you need a sharp needle. That is also contains the expiry date. Again, this is been expiring in 2029. That will be mentioned over here. In the cap, there is a small plaster. So you will be checking. If you're happy, you will collect everything in the tray. You don't need any much articles or anything. As far as if you can verbalize that the site is clean, you don't need to clean it again. But again, you can take some gauze pieces and your alcohol wipe in case if you need, and you need a sharp pen. So after the collection of your articles, you're going back to the patient, you're going to recheck the ID, and you'll be telling that you're going to start the procedure. How are you going to start with the procedure? Okay, I'm going to teach how to use an insulin pen using an insulin, how to use an insulin pen for your subcutaneous injection. So first of all, you're going to check the patency of your insulin pen. Just make sure that this is working, isn't it? So when you get the medication, you know that this is within the expiry, and if you see the transparent area that contains the medication, so before you open, it's always good to roll the injection pen, because sometimes there are possibilities of sedimentation. So either you can roll to and fro for 10 times or with your palms 10 times. Okay, so it should be repeated for 10 times, and after that you are going to open the cap. Okay, so this is, again, you can detach it very easily. There is nothing to be worried about. Get the needle. So when you are opening the needle, obviously you can see that there is a plaster where you can peel it off very slowly, and you can attach it or screw it. So you can tighten it, and you can see there is a cap. Okay, so before you open this, always make sure that your site should be checked and verbalize that the site looks clean, you're okay with the site, there is no signs of infection, there is no signs of erythema, and all these verbalization as per the criteria has to be followed. And then if you're okay, then obviously you can open this and you can see another sheath. So do not open this until and unless if you're not feeling comfortable, or if you are opening this sheath, then your only step from now is going to be administering the injection. Okay, so I am not going to open this cap, but I will make sure everything is very close to me. I have checked the site, all the checks has been done. If I'm happy, that is the only time that I'm going to remove the cap. So and that's again very small cap, so you don't need to worry about it. All these articles will go to the tray, and what will happen, you're going to make sure that you're going to take the required amount of dose. Okay, before that, obviously this is insulin, that is needle, you have to prime it, isn't it? How are you going to prime it? Is very simple. You're going to dial till 2 units. Okay, I'm going to show. See, I'm going to take 2 units. If you're dialing from here, then obviously you can see that this is rolling. So I'm going to take 2 units and give a gentle press. I'm going to press, and if I'm pressing, you can see that the tip contains the drop, isn't it? That is how you're going to check whether you are removing the extra air bubbles. As far as if I can see that, and I will just make sure I'll be expelling that 2 units and correcting the, removing the air bubbles. And if I'm happy, I'm going to adjust the dose. What is the required dose? If it is 60, you're going to turn it and make it on 60. If the prescribed dose is 6 unit, I'm going to just check it or dialing it at the number of 6, and I'm making the right dose. Now I'm going to administer the injection. So if everything is okay, usually you are pinching the site, isn't it? But when you are administering it, you wouldn't be pinching for insulin injection using the pen. So obviously your marking criteria says you have to pinch it, so verbalize that. I will be administering it. If it is, I will be pinching if my patient is very thin, but here I'm not going to pinch, because usually for your insulin injection using insulin pin, you don't need to pinch it. So I'm going to administer again at an angle of 90 degree. You're going to administer, and then you are going to administer the medication very slowly, and then wait until 10 seconds. Okay, so you're going to count again 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take the needle out, and then you can tell that there is no bleeding. Obviously this is insulin pen, so you're not going to get any needle, and immediately you are going to discard. So slowly unscrew your insulin pen onto your needle, and this needle will straight away discard into the sharp bin. Clear? And then you can cap with your pen cap, keep it back into your tray, and verbalize again the rest of the things, that all the articles will be clean and ready for the next use, and you will be discarded all the articles which you have used in the appropriate bins, and so on, so things. You are going to do a hand hygiene after removing your PPEs, coming back, and immediately after the hand hygiene you are going to document. You're going to sign date and time. After that, you're going back to the patient, reassuring the patient, make sure the patient is comfortable. All the checks has to be done before you come out, and then you're going to do your final hand hygiene. So basically, there is no change in the procedure. Instead of the syringe, you are going to use the pen. So when you're using the pen, obviously you have to cap it, and then needle has to be capped or screwed properly, and then make sure that you're priming it with 2 units, and then you're going to insert the injection. Leave it for 10 seconds and then take the needle out and discard that straight into the sharp bin. So it is much easier if you're getting the insulin pen, because you don't need to draw the medication, you don't need to clean the medication vial. So all these procedures are making your life quite more easier. So you will be less stressful. So no need to get panic about your insulin pen. So this is very straightforward. So if you're getting, this is how you're going to do this. But at the same time, the criteria hasn't changed. So if there is any change, I'll be reposting the video. So what I have shown is how you are using the pen on your usual days. Okay. So thank you so much for watching. Bye.